Okay, so we're gonna come back as a room and just have a little bit of time together to talk about what we just did. So we are not going to ask the tables to try to synthesize back their discussion or what things they arrived at, because we only have about 15 minutes. Yeah, thanks for Reed. Those were some useful tools we got from Arena Stage this morning. Great. So we just have about 15 minutes. You know, as I said, we have note takers who've been kind of tracking some of the key things. So we're not going to try to say all those back to each other because that would take us a whole day probably. But I just wanted to ask the room, anyone, you know, just let's start with, was there anything that surprised you out of the conversation? You know, a topic that came up that you weren't expecting to, an idea that you got that you hadn't thought about before, a place where you got stuck as a group, that kind of thing. We'll just open it up for a little while. Yeah, Esther. Please do say your name also. I might not happen to know it.
Okay. Esther Dyson. So this is really a kind of the result of being a bad girl and walking out and talking to some other people. But as you think about evaluation, it's interesting. You can decide whether it's relevant or not to also think of the analogy of testing in school at the end of the year. You know, what did this kid learn, A, B, C, D, or E, versus mastery learning, where instead of just teaching to the test at the end of the year, you do more like, did you get this particular subject? If not, let's have a group of kids that can go through memorizing the alphabet again and again, or you know, let's do calculus till you've got it, so that the goal is not to figure out whether they did well or poorly at the end of the year, but to help everybody in the class get to that level of mastery. And you know, speaking for Wellville, we do need evaluation, but I think the mastery learning approach, where the communities help one another to reach that level where they're going to get an A at the end of the year, is an interesting one to think about.
Thanks. Anyone else with something that stuck out to you? Sure, go ahead. Oh,
hey, my staff would love that because I pressed mute instead of the one on.
No, you go ahead. And then we have one in the back, but we'll start with you in the middle.
Okay. I'm Bill Wysork from Buffalo State and working with Niagara Falls. One of the things that became really clear when we were talking about the community health workers / navigators is that you can think about them as individuals, but they're really embedded within a whole variety of systems. And doing the evaluation requires looking at those impacts and coordinations, especially among the systems, at least as much as what the individual community health workers are doing.
Yeah. It's not just the individual interactions, it's the systems interactions that you expect to follow. So now we'll go to the back of the room.
Well, Peter Backrack. Just one question that came up at the end, which sort of underlies everything, is where's the money for the intervention and for the evaluation? You know, where's this magic money coming from?
Well, it's a hypothetical today, so we can pretend we have a ton of money.
That's what we did. That's what we did. So.
No, but that's a key, right? You can't get away from that. Things cost money. Yeah, sure.
Hi, this is Senthil from Spartanburg. I think a lot about data, and one of the things I know Rick Brush mentioned, how insurers might get involved. And in our conversation, what we found out is, you know, a lot of the people who need this help are in Medicaid or in uninsured, so it's hard to get their data from a cost point. But the local city governments and the jail sets, they have their own set of data, and those things are much easier to get. And those guys can potentially be, if we can show that they can save on building another jail by, you know, putting money into this, that's an interesting side of changing the system that we recognized.
Anyone else? Sure.
Carl Wendy, Buffalo State College. We had an example of using case studies to help describe the process of what was going on, and I think even in the discussions here, I think it's very important to have examples of what happens, and it helps us as evaluators, but I think it helps the neighborhoods, communities really identify, yeah, that speaks to me, or it doesn't speak to me because of this item, and then gives you more ideas for further evaluating.
Anyone else? Kimberly?
Hi, I'm Kimberly. We talked about the use of mixed methods and not mixed up methods, and why that is important throughout the evaluative process and how it really becomes important during your data analysis and synthesis, and that a lot of our measures and a lot of our outcomes need to be quantitative and qualitative measures and not just metrics in terms of really trying to figure out how much outreach, how many contacts, how many referrals these navigators are making, but also understanding why it's working, where it's working, why it's not working, what are the opportunities for systematic reset, and of course we also talked about toys and tools, so the use of technology and GIS mapping and hotspot identification was all good stuff.
Rick?
Yeah, we had, there's 2 Wellville communities represented here, and we had a request that as the communities navigate this really complex world of evaluation and also look at implementing continuous improvement processes, and then finally look at issues like HIPAA and privacy and ethics, that some technical assistance to be provided across the Wellville 5 would be really valued. As opposed to each community sort of recreating the same process locally, and trying to find, you know, the consistent expert resources in 5 places. Let's potentially provide a resource that can work across all 5.
Did anything come up around ethical issues? I think a couple of the tables, at least I heard, were going through that. So anybody want to share anything that came up around the ethical issues with the evaluation and the engagement? And I know some of you talked about them.
One was the ethical obligation to engage the community and to articulate and have the community understand what a purpose of an evaluation is, what evaluation means, and making sure that that was evident, and then the continual feedback process, so it isn't just a grade at the end of the year, but it's really a commitment to, on the part of whoever is doing the evaluation, to be kind of in there in the trenches and making the, providing the information back and making it work. And we talked about actually articulating what those principles of engagement would look like, and then a little bit about, you know, how the money flows, and thinking about that in ethical terms as well.
Any other nuggets? Can you turn on a mic? Thanks. And tell us who you are.
Oh, sure. I'm Kathleen Noonan, and I said, guys, tell me if I get this right. So we talked about, there was a lot of interest in including community members in the evaluation team in some way, but then we talked about making sure that we didn't set them up because they were potentially then evaluating their peers, right? So like, how do we pay attention to sort of like, you know, power dynamics and community dynamics, and not, you know, I don't know, have one neighbor looking over the shoulder of the other neighbor. So does that...
Particularly when we want to connect the community.
That leads me to maybe a related question, which was there anything that you might want to share about potential negative effects and how you would figure out whether or not they were happening? Unintended?
Marvin with Hiccup. One of the things that came up at the very end for us was that the responsibility of having the navigators being judged or measured against the actual physical outcomes just doesn't seem right at all. You know, they're not the ones that are responsible for, you know, Mary or Mike's heart condition. I mean, they can get them maybe to the hospital or get them exercising or eating better, but that doesn't necessarily equate to a improved health situation. So that debate started at the very end. I wish we could have talked a bit more about that. If It seems so real. That's really kind of, is it the program or is it the individual that we should be evaluating?
Yeah, and that links to some in the panel talking about how you are thinking not just about accountability, but also about the rest of evaluation and how it's, you're not making each person accountable for the very final outcome, but it's a contribution. It's like, how are you framing their contribution? Yeah, I think that came up a few times. Anything else about the negative effects? We'll jump over there and then come back to.
Sorry. Uh-oh. So I just, one comment, being a non-evaluator, about that. I think sometimes we're afraid that we're going to evaluate somebody inappropriately, and it keeps us from evaluating at all. And so for that care navigator, not navigating because it's not that person's responsibility for your heart disease, I think gets in the way of us trialing some things. And I'd much rather see us evaluate the outcome, healthcare cost, health improvement for the navigators rather than worry about whether it was the individual relationship. I'm not saying it well, but I just, I think we can't be afraid of failure. That's one thing, because there's no solution or we would have already all done it. So trying things, and if they don't work, don't be afraid of them, but you still got to measure it, because if it didn't work, it doesn't mean you were wrong. It might have meant you just missed one little piece. I mean, so I wouldn't, we try really hard not to let our fear of evaluating the wrong thing keep us from measuring it all.
I think I overheard a lot of discussions about thinking about ways to try to have the people who are in the community themselves using the evaluation from the very beginning and maybe understanding the purpose of it. So that was like a solution that was discussed at some tables.
It's not the grade and the test at the end that Esther said, and I think so often that's what people assume, is it's going to be judgmental, and it's not. It's just a valuable tool to help you get better.
So I know you had a comment in the middle, right? And then I'll go back to you in the back.
Okay, I have two, just to follow up on Bill Wysork again. One is that when it's evaluating, for example, the community health worker isn't responsible for the ultimate outcome. They're in that system, and so they're making referrals and so forth. So they do need to be evaluated on what part of performance that they have and which part of the system otherwise need to evaluate it on other kinds of outcomes. And I think that's a very important part to, share while that's happening. The other thing is that when you talk about unintended consequences, it's very likely that we're going to overwhelm the capacity of some systems to respond to the number of referrals and things that we need. And sometimes the system will be able to ramp up and sometimes they won't. We'll find that out, but I think that's going to happen almost universally as we send more people to systems that aren't used to getting the more people, even though they're supposed to deal with them.
He just stole my comment.
You can endorse.
I was just going to say, yeah, I mean, in terms of it's not negative necessarily, but even if we evaluate that the program was really successful and everyone was connected to the resources that they need, then now the primary care doctors are completely overwhelmed, which they already are even before this started, and so then you actually find larger system issues, we talked about this a little bit, that you then need to deal with at that level. So that's a good thing and a bad thing, I guess.
Yeah, sure, Britt.
I'm going to follow up with the note that Dawn just wrote. I'm going to out you here. We needed a week for that exercise. Can we have that next time?
That actually is what we are hoping is a really strong takeaway, which is that this is not a trivial exercise. You need to, if you left feeling like we barely scratched the surface of this, that is an outcome that we were aiming for.
But I think the other takeaway is never write a note to me in the middle of a meeting. But actually, what I found really interesting about the exercise was that we kind of spent the whole time debating what is the intervention. We just kind of like kept picking it apart, and then everyone every now and then, Elizabeth especially, was going, can we get to the evaluation piece? So it was actually kind of interesting for us. I felt it was really interesting because we really needed to unpick the intervention more and more and more and more in order to really understand what would we evaluate. when. And some of the capacity issue we talked about, well, actually, is part of what we evaluate is how well does the system respond to our feedback to say this system isn't able to handle the capacity, now people know how to navigate the system. So I thought it was actually kind of interesting that we only just began to unpick the problem, which is why Dawn wants a week next time.
Mm-hmm. So I'm going to use that as an opening to reinforce something that came up. We did a workshop on evaluating complex global initiatives in London in January. That's what's out there if you want to copy. Chance for a plug. Thank you, Kimberly. But we, not as a whole group, but we had a couple of panelists do a hypothetical design exercise in a very short period of time. And one of the main messages that came out of that was the value of really considering having your evaluators, not just having your design of the evaluation be integrated with the design of the initiative. So there were a lot of tables I heard having trouble separating those. And it was really frustrating, and I thought, I'm going to look for a window to reinforce the idea that actually, instead of making that frustrating, maybe that should be the task, which is that you're thinking both about what is the initiative and also what is it, how are we going to know whether it's doing it, so that you have your evaluators there right from the beginning. So thanks for that setup. Yeah, Colin?
Hi, it's Colin Weinberger. So yeah, I think we talked actually a little bit, quite a bit about sort of evaluation, almost I would say evaluation as process and evaluation as a vehicle for program development and developing sort of a culture of data use and using evaluative information throughout the course of a program as a way of building fluency in using that data and making the data relevant to the people who are actually collecting it and using it, and then also having the evaluation, I guess, that might work towards making evaluations feel less like, okay, this is the time that I am being evaluated in a sort of value judgment kind of way, versus this is a process improvement.
Well, we have one more break, and then we have one more discussion to happen. We're going to have a panel of 4 people we've recruited to think about the use issues and talk a little bit about, if we manage to do all of this, better, what would that mean? What value would that bring? Why are we doing it? So we're going to come back at 4:30, and everybody's going to hang in. Thank you very much for participating in this crowdsourcing evaluation design exercise. It was really fun to listen in, and I know really, really hard to do. Yeah, thanks for trying it out with us. So little break, we'll come back at 4:30.